Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Next Center here in Fort Myers, Florida. When I was in training in medical school, so I went to medical school at the University of Illinois, then I did my internship and residency at Hines VA Hospital, was also at Loyola Hospital and Marion Joy Hospital, so shout out to all the people there. I got amazing education. And I'm a physical medicine and rehabilitation specialist, which is called a physiatrist. So I always thought of physiatry as it's the medical specialty in medicine that's recognized by the American Medical Association that is the most holistic. So I was basically trained to figure out how can we optimize a person's functioning despite their disability, right? And in the last 30 years, it's been amazing. It's been amazing, right? I don't know if you guys watched any of the Paralympics from Paris. It's amazing. The athletes and everything, like how far we've come to optimize human functioning, even if somebody has a disability. I happen to specialize in the disability that we know as chronic pain. Because early on, I figured there had to be a cause of chronic pain. And basically in 1992, so many, many years ago, I met Dr. Hemwall. Dr. Gustav Hemwall was the guru in prolotherapy. He learned prolotherapy from Dr. Hackett. Dr. Hackett invented prolotherapy, or coined the term prolotherapy, in the 1950s. He wrote a lot of books on it. I should say he wasn't like the first person to do tightening of ligaments by injection. So there was definitely some osteopaths back in the day that did that, Dr. Schumann and others. But as far as like coining the term prolotherapy, doing the animal research to prove that the ligaments were tightened, writing scientific papers. Just the other day I went on PubMed and typed in George Hackett, and it was amazing. They had like 18 of his papers there. I mean, they're very, very innovative. Then he wrote a book called Tendon and Ligament Relaxation Treatment by Prolotherapy. And one of my prized possessions, if you will, is I have all 5 versions of his book. I have one of his books where he signed it. He died in 1969, and he was born in the 1800s. His main apprentice was Gustav Hemwall, who he met at an AMA convention in the mid-1950s. And then Gustav Hemwall, after Dr. Hackett died in 1969, he basically was prolotherapy between 1969 and 1998, when Dr. Hemwall died at the age of 90. I had the honor of being hired by him in 1992 to be the doctor who took over his practice. So I took over Dr. Hemwall's practice when he died. And I have a lot of great Dr. Hemwall stories. And then what I did was I knew that he was older, so in the office we filmed like about 1 hour of me talking to Dr. Hemwall. So the reason why I did that, so people could, hear Dr. Hemwall. So I know parts of that interview are on the internet, so I'd really encourage people to look at that. But I started talking about that because when I was getting trained in pain management, there was so many people that were diagnosed with fibromyalgia. Back in the 90s, fibromyalgia. You almost don't even hear about it now, right? What you hear about now is what? Long haul COVID. It's almost like every few years there's a new disorder that gives chronic body pain and non-restful sleep. Like we've gone through what? Fibromyalgia. Then there was chronic mold disease. And I'm not saying that chronic mold disease doesn't exist, or chronic allergies, or chronic Lyme's disease, or chronic fatigue syndrome. It just seems like every 5 years or so, there's a new thing where we don't know the cause. Maybe it's a virus. Like now we're saying it's long haul COVID. Like obviously long haul COVID, the symptomatology of it exists, but the pathophysiology likely, just like fibromyalgia, is related to the neck. So I just want to talk about that, and I'm going to explain why I think all these, not all of these, but many of the chronic painful disorders that are all over the body stem from the neck. And there's even data as it relates to fibromyalgia. Now, when I also want to say fibromyalgia is one of the things that led me into chronic pain management, because if you talk to the people, you would see that it pretty much happened either insidiously, it gradually occurred that they got body pain, or it's amazing how many people would tell me, no, I got a car accident, or I had a fall, or I had some kind of head trauma or neck trauma, and then all of a sudden I got all kinds of body pain. So that is partially what led me into getting into pain management and thinking that the really problem is the neck. Now, initially when I was researching, because what I would do is, this is before the internet era, I would research weird pain syndrome. So my initial folder in medicine was on weird pain syndrome. So just like I do today, I research. Of course, now we have the internet, but back in the day I had to go to the library. And I found a study, which I'm not going to quote here, I just thought about it now, but they took medical students and they just disrupted their sleep for 3 days, because, you know, what a great group to study as medical students. So all they did was disrupt their sleep for 3 days, and guess what? After 3 days, they had all these tender points suggestive of fibromyalgia. So absolutely non-restorative sleep. Non-restorative sleep can always give the symptomatology of fibromyalgia or whole body pain. Like even last night, because my best position to sleep in is on my right side and my head extended. Well, I'm starting to get like some arm pain, some shoulder pain. I might have like a little bit of tendinosis or something in my right shoulder, and I'm thinking about going to Danielle Matus at Caring Medical. I've seen really good reviews of her. She's in Fort Myers, Florida, which is the town I live in. And then they do prolotherapy there, and I read some good reviews on prolotherapy. But I just mention it, like, if a person gets better sleep, like on their right side, but then they have an injury of their right shoulder or something, they can't sleep that way, now they sleep a different way. It's amazing how many people, I found that was the impetus for them getting fibromyalgia or whole body pain. They just had something where they had a hip problem or a shoulder problem or something where they couldn't lay the normal way. So it's just kind of an interesting tidbit if that's you. So obviously in those cases, I got to get them to sleep back in that position. So it may be that the person needs some prolotherapy into their hip or their shoulder. And if someone's not familiar with prolotherapy is an injection technique that causes a tightening and strengthening of the ligaments, or a strengthening or stimulate the repair of the tendons and ligaments, which often cause pain, because the nerve endings that give pain are in the tendons and ligaments. That's not the only nerve endings that cause pain, but most of the pain, in my experience of chronic pain, is from ligament injury or tendon injury, but usually it's ligament injury. So fibromyalgia is where there's certain points of the body where people have these tender points. So when I first started, I had a dolometer where it would tell how much pressure it took to elicit pain. So like for instance, I might compare the inside of the knee to the outside of the knee, and the inside of the knee was much more sensitive. It took less pressure to elicit pain in that area than the outside of the knee. And usually fibromyalgia starts before the age of 40, and it is associated with non-restful sleep. But think about it, if you have all this pain all over your body, it's going to be hard to get good sleep. This is one of my favorite studies. Anybody interested in this topic, please look up the study, Neurologic Signs and Symptoms of Fibromyalgia. They looked at the prevalence of, they compared 166 fibromyalgia patients to 66 people that were the control without fibromyalgia. And I just look at all these symptoms that were in the fibromyalgia patients that weren't in the non-fibromyalgia patients. All these symptoms are common symptoms from vagus nerve dysfunction. So 44% of the people, they found that they actually had vagus nerve dysfunction. These are also common symptoms: dizziness, ear pressure, hoarseness, lightheadedness, palpitations, poor balance, ringing of the ears. These are common symptoms you hear me talk about all the time because of ligamentous cervical instability. So again, symptoms aren't isolated. Like very seldom does somebody just have chronic body pain. They have all these other symptoms. So are all these symptoms related to one cause or multiple causes? And I would say it's most likely going to be one cause, which is a problem in the neck, screwing up the brain, screwing up the vagus nerve, screwing up the body. So Hauser neck vital analysis plus dynamic structural testing, that's what we call the testing we do in the office here at the Hauser Neck Center to document ligamentous cervical instability. So ligamentous cervical instability commonly causes fatigue, brain fog, head pressure, mental health care concerns, mental illness. And by that I just mean anxiety, depression, changes in personality. Like if you're normally an upbeat person, then all of a sudden you're Debbie Downer, that's a change. That's a change in your personality. When people come in, the average person at the Hauser Neck Center has something like 10 symptoms. So I would pretty much never see somebody who they just have body pain. They have body pain plus dizziness, plus palpitation, plus ringing of the ears, plus ear fullness, visual distortion. So it's likely there's one commonality causing all of it. So when you have ligamentous cervical instability, you have changes of the neck structure. So the neck curve breaks down. Basically what happens is the atlas goes forward, compresses the carotid sheath. So compression of the carotid sheath is Hauser law number 3. So if a person has a chronic symptom, like they have a chronic symptom, especially a brain symptom, it's likely it's going to be caused by carotid sheath compression, and in the carotid sheath is the internal jugular veins, which is the main drainage port of the brain, and also it houses the vagus nerve, and the vagus nerve innervates the spleen, which has to do with your immune system. It innervates the digestive tract, which involves nutrition. Many of the hormones in the body are made in the digestive tract. So if a person has a decrease in the electricity to the spleen, that of course could cause a problem in the immune system. I should say the vagus nerve goes into the celiac plexus, which goes into the spleen. That's how the vagus nerve affects the spleen. All the digestive tract organs, the electricity, a lot of it is through the vagus nerve. So if the stomach doesn't have the right electricity, you don't make the right stomach acid, digestion is affected, you eat, then the stuff just sits there, it just sits there. And you feel bloated, you feel nausea, right? If you feel like you can't digest your food as good, your bowels are sluggish, you've been diagnosed with SIBO or leaky gut, meaning that the tight junctions of the digestive tract are now open, so things in your digestive tract now get into your bloodstream. So that's where you get a lot of food sensitivities. If all of a sudden you can only eat 6 foods, it's likely you have ligamentous cervical instability causing vagus nerve degeneration, causing the leaky gut, causing your food sensitivities. People with mast cell, they have histamine reactions. That likely is from ligamentous cervical instability. You might say, why are you saying that? Like, I go to a holistic provider. Yeah, but if you're getting resolution of it, well, you don't need to watch this video. If you're watching the video, it's probably like you're not getting resolution. And especially if somebody has clicking, popping, grinding of the neck or neck tension, and they have all these symptoms, or you've been diagnosed with fibromyalgia and you got body pain, and you're like, yeah, my neck click, 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 and I got to keep going to the chiropractor. Yeah, well, you probably got ligament damage. The ligaments are what hold the bones together. So if your bones are moving excessively, obviously it's going to encroach on the things where the bones are going where they're not supposed to. Well, what's there? Well, what's there is the jugular veins and the vagus nerve, right? So many chronic disabling pain syndromes are characterized by body sensory hypersensitivity, meaning that if you have body pain all over, but you have light sensitivity, like you're noticing the sunlight hurts your eyes, or you have sound sensitivity, We have patients with touch sensitivity. You have chemical sensitivity. You have food sensitivity. You have all these sensitivities. Vagus nerve dysfunction, it can cause all these things. So often people with fibromyalgia may have all these other things. They may have restless leg. They might have irritable bowel, painful menstruation, depression, post-traumatic stress, different kinds of pains all over their body, migraine. So that can all stem from the vagus nerve. Sometimes people with body pain, they'll say, "Doc, it seems like now all my joints are cracking, or my whole body's decaying," or recently a patient said, "It feels like my brain is unplugged from the rest of my body." So why would that be? Well, if the vagus nerve is getting degenerated and the electricity to the various organs isn't there, the organs aren't going to function good. And of course, it's a spiraling decay for the body. Okay, so this is another one of my favorite fibromyalgia studies. So it's increased rates of fibromyalgia following cervical spine injury, a controlled study of 161 cases of traumatic injury, and this is from 1997, so that would have been early in my career. Think about this. People come to the emergency room, 102 have a whiplash injury, 102 patients have a whiplash injury, and 59 have leg fractures, and they just see what happens over time. What a great study, you know, like let's just see what happens over time. And these are young people, so it's not, we can't say this is due to aging because they're in their 40s. So they're seen 1 year later. So they go to the emergency room, 100 of them have a whiplash, 60 of them or so have a leg fracture. That's just the dividing thing. So no person had chronic pain prior to the injury. Basically, by 3 months, 21% of the whiplash injuries had fibromyalgia. 3 months after the whiplash. Only 1.7% of the leg fracture developed fibromyalgia. And I would concur or believe that the 1.7 were probably people, because of the leg fracture, they probably had non-restful sleep. But basically, fibromyalgia was 13 times more frequent following the neck injury versus the lower extremity injury. So I think this is powerful evidence that cervical ligament injury can cause fibromyalgia. So if you're somebody who has body pain, you have all these tender spots, you can't even get a massage because you have basically hypersensitivity, right? If you think about it, it's hypersensitivity to touch or pressure. You probably have ligamentous cervical instability, especially if you change your diet, hypoallergenic diet, gluten-free, dairy-free, you've had a food sensitivity test, you've gone to the holistic providers, you've gone to physical therapy, done chiropractic care, and you still have all these symptoms. It's likely that you have a neck problem, especially if you have clicking, popping in the neck or tension in the neck. So the treatment needs to be directed at correcting the structural neck issues, which involves prolotherapy of the neck to tighten the ligaments, and of course restoring the cervical curve by getting prism glasses, getting your computer high, possibly putting weights on you. That's what we do in the office, just to see if your neck curve improves. And we do periodic x-rays to make sure that your neck curve improves. Then we get you sleeping in a position that maximizes your jugular veins opening, which can help get the brain to function better, probably is going to give the person a lot better sleep. And then obviously that has effects as far as healing of the body, and over time the tenderness goes away, the body pain goes away, and not only is the patient happy, but I'm happy.